Hello and welcome everyone. Thank you for joining us today, in our series on IVF and fertility to help you take a step towards parenthood. In the last few episodes, we've spoken a lot about when you need to go to a fertility expert, what are the kind of what all does an IVF procedure entail. But today we're going to discuss what are the things that you should take in mind if or keep in mind if you're considering an IVF procedure. Joining us in this conversation today is Dr. Kasi Sellappan. He is the medical director of Conceive Fertility in Bangalore. He is also a fertility expert and a gynecologist who specializes in high risk advanced obstetrics and has been doing so for the past 20 years. We're just waiting for Dr. Kasi to join us, and then we will begin our conversation.
Thank you very much. Thank you. Thank you for this invite. And I'd like to thank all of you at Hindustan Times and Parents of Fertility in association with Merck for giving me this lovely opportunity to have this chat and interact with patients so I can just take questions and hopefully it's a fruitful chat.
Absolutely, sir. Thank you so much. I think the first thing that we need to address in this conversation is that when we look at fertility treatments, IVF isn't the only option out there. So when should a couple consider IVF over these other infertility treatments?
Okay, so if we were to look at what's available on the platter first, and what is fertility and what is infertility otherwise. First thing is when a couple has been trying for about regularly, when I say regularly, having regular sexual intercourse interprets as 3 intercourses at least in a week. If that is going to be the case, then for up to 1 year, 80% of the couples usually conceive. But on the other side, the rest of the lot, the 20% of that lot, another 8% tends to conceive in the second year. So when we look at all those things, we also know that, only that 8% bracket is something which we need to look at. So that is one side of the thing. And here, when we look at the fertility component, these people who are struggling, why are they struggling? And if you divide the causes of fertility in a broader scale, if I were to say 33% can be male related, 33% can be female related, and 33% is unexplained. So when we say unexplained, then that cadre is the one which we need to look into, because that's the frustrating component where they couldn't find a cause for them, but they still can't get pregnant, and they've been trying regularly. So these things are what we need to look at, and if at all it's a female factor, then what's the cause? And you need to see 1 year of trying, no conception happening, then it's always a good idea to check it out as to what's happening. So that's the start. 1 year of trying, check it out if it's not happening. And then at least they can start off with some investigations, preliminary stuff, nothing invasive at that point. So if at all anything rectifiable found at that point, then we can look into management planning. But, at least 1 year would be a good span. And after that comes investigations. First thing to do, check the ladies' hormones out. Okay, we don't like to spare the men. So we want to check their sperms out, make sure that the semen component is fine, because at times we've screened the lady completely upside down and everything is absolutely fine. And then you'll be wondering what hit you if there are no sperms or there are no moving sperms or anything like that. So we want to rule out the sperm component as well. So male component ruled out, female component ruled out, then still nothing happening. Then it's the time where they need to think about what we need to do, because even then, see, the common question which I get asked in clinic, polycystic ovaries, very common in India, or rather India, the Asian subcontinent itself. So these women, they always they are a little bit on the higher end with their weight, they're not getting their periods regularly, and they just want to know, doc, I'm not conceiving, what's happening? Very simple trick is to lose weight. If they lose weight, the hormones regulate. So when the hormones regulate, then she's ovulating. If she's ovulating, then they don't need any fertility specialist. They can conceive on their own. So this is called anovulatory. So the start will be, say, ovulation induction. Give them a few tablets, see if that does the trick for them. If it doesn't do the trick, then you move up the ladder. Say if you want to club it with intrauterine insemination, So does it, because that's the least invasive one when we are going into that route. Intrauterine insemination, basically purification of the sperms of at least mild male factor, not drastically abnormal sperms, a little bit of iffy sperms, we can clear it, put it into the lady, then see if that works post ovulation induction. And all this tricks not working, then comes IVF. So that's the time we talk, about IVF.
Okay, so tell me something. When we talk about women who are not ovulating properly, who are missing their periods, that would also mean perhaps women who have PCOD or PCOS. So do you think they should be the ones who opt for IVF or at least see a fertility expert, women with PCOS or PCOD?
Okay, when you talk about PCOS, PCOD, we need to split it a little bit. Okay, if, as I said earlier, the simple question when I ask patients when they come see me, is she having regular periods? If she says, yes, I'm having regular periods, then I think my involvement should be minimal over there. Because if she's having minimal, regular periods, her hormones are intact. They are playing their role, so she is ovulating inevitably. That's more or less how it works. So this is, if I'm gonna get a scan machine and scan, most of the place where I live, a lot of youngsters will have PCOD. But is it
Yeah.
worrisome? Is it not? Is it creating a bother? That's what we need to consider. If it's not creating a bother, absolutely fine. Then check the other hormones like thyroid function and everything. If she's having regular periods, I'll leave her alone. Ask her to try on her own. I wouldn't say jump to the fertility wagon straight away. As long as they've tried for a year, even though being diagnosed with PCOD, having regular periods, that's the key component. So that should be fine. But irregular periods, not regular, once in 2 months, overweight, then again, try to lose weight first. Lose weight, see if the period regulates. And at the same time, you can also concurrently check it with the fertility guys or girls, where you can check your thyroid function and everything, make sure that is all fine. Then, that should be fine. Just leave them alone for a while, reassure them. That should do the trick most of the time.
Okay. So ovulation is key here, and because of which periods are key here. So if you're getting your periods regularly, then you won't be sort of made to, or no doctor will possibly suggest you to jump to IVF right
Yes,
instantly.
no, not IVF straight away. No.
Yeah. Okay. So is there any way in which couples can evaluate if the IVF procedure is right for them without visiting a doctor?
Okay, very simple thing. Okay, if we look at how humans are made, all right, women. Okay, nature has been quite tricky in that way, where all the eggs the girl or the lady carries are as old as her. Okay, so if you're gonna deposit some money which is in a bank, which is not gonna give you any interest, keep it that way.
Yeah.
A girl is born with a lot of eggs in the bank, which is called the ovary, and there is no interest for it. And she's gonna every month on month, the eggs are gonna be withdrawn. All right. So the earlier phase, when we talk about the ancient days, our ancestors might have said, even in families, they say get married sooner, make babies sooner, and all those things, because of the age, the window of fertility, where we talk about the early 20s to the 30s, very early 30s, or even close to 30. So that is the age group where the girl is most fertile, as well as, when I say most fertile, the chromosomal content in those eggs are very much good. So as the girl goes of age, or she becomes more wiser, I don't want to use the word older here. So then what happens? The quality of eggs starts to depreciate or deplete. So the quality goes down, which means then the possibilities of chromosomal problems are higher in the babies which are going to be formed. And at the same time, the quantity of eggs are also going to depreciate. So fertility becomes difficult at that point. So age is one key factor. So younger is always better. But and the other thing is, we need to look at other problems like any other fertility issues, rather fertility, say endocrine issues. Say if the girl's got an underactive thyroid or an overactive thyroid or anything of that sort, then it's always better to seek help sooner rather than wait on it. So as long as everything is fine, assessing fertility, is it a requirement then? When they are thinking, I need to assess my fertility, then there is a problem somewhere because they've been trying for a while.
Yeah.
So that will be the answer there for the question. So a point blank answer, it's not there. You can't clearly say, but if you're going to think about it, please think, closer to the doctor then.
is essentially then what you're saying is, if let's say you're in your, let's say, mid 30s and you've been
Yeah.
trying to conceive for a while, then you may not want to make up your mind about going to get an IVF procedure, but you should at least consider this as a sign to go see an expert or a specialist.
Yeah, absolutely, absolutely. Because what happens, there are some trials as well, which I can quote. As I've already
Mm-hmm.
said, the egg reserves, they are as old as a lady. Okay, so when the egg reserves are as old as a lady, some trials have been done globally to find out about compare Caucasian women, Afro-Caribbean, as well as Asian women, and all they found was, Indian woman, and comparing with the Caucasian or an Afro-Caribbean woman, say a lady of 36 years over here will be equal to a lady of 30 years over there. So, sorry, it's the other way around. So, a 36-year-old lady there is a 30-year-old lady here, which means ovarian aging in the Asian subcontinent is quicker. So, it's always better to seek help if at all that's the case. Mid 30s is high time; they must seek help.
Yeah. Okay. So I think the next question is more about the most relevant question actually during these times is that, with COVID upon us and now talks of a third wave and possibly a fourth wave after that, um, for a couple to undergo an IVF procedure, what kind of things should they keep in mind?
Okay, the first thing I would say, the first and foremost, because now if you look at, the government of India had released a guideline, I think on the 29th, which is yesterday, on even vaccinating pregnant women, getting them on board as well with the vaccination component. So the next thing is, even lactating women are allowed to be vaccinated. So it's
Hmm.
always prevention is better than cure, especially when we're talking about COVID-19. And it's always good to get vaccinated first prior to embarking on this route of fertility. So get vaccinated, then at least you're healthy, because pregnancy is a state which is, which can put you into difficulties should, God forbid, anyone suffer from COVID infection.
Okay. So I'd like to take you back to what you said earlier about, if women who are trying to conceive are unable to conceive, they should try to lose a little bit of weight to
Yeah.
normalize menstruation, ovulation. Apart from this, are there any other lifestyle changes, especially when it comes to diet, that men and women should keep in mind to ensure a healthy IVF pregnancy?
Okay, the first thing when we talk about IVF, right? We want a baby, not just a
Hmm.
pregnancy. So
Hmm.
I'd say for them to go start the route, or before they start the journey, they need to tick certain boxes. One is mandatory for anyone trying to conceive, not just IVF, which is folic
Mhm.
acid. So they should start themselves on folic acid. If the lady is on the higher end of the weight, she'll need a higher dose of folic acid, like 5 milligrams. If she's at a normal weight, then up to anything above 400 micrograms is apt. So folic acid is important. She should have a healthy lifestyle. So that is important. And when I say healthy lifestyle, what all of us know we are sensible adults. So I would say we're talking about overload of fat, overload of carbs, all those things. If they can minimize it, because I don't like to take all the pleasures away from any human. So as long as they minimize it rather than completely cut it down, it's good. Smoking is not great, and alcohol as well, because I say for a smoker, I've never been a smoker in my life, so I can't comment on it. Because for a smoker, when I say, can you stop smoking? They say, I'll try, which means
Yeah.
then hopefully when they say, I'll try, I take it as at least he'll reduce half a cigarette a day. Uh, at least that's fine, as long as he can cut it down. Even when we talk about alcohol, is exactly the same. Nowadays, I see quite a bit of women who are smokers as well. But I say, try to cut it down. The reason is because smoking is one killer, where we all talk about smoking causes lung cancer. That's it.
Yeah.
But that's not just as simple as it is. It's not a simple thing, but smoking causes plenty of other things. A lady conceives, she can miscarry. She might end up with a very tiny baby. She might, deliver, prior to term, quite very preterm. So all those things are not required in someone who's trying for a baby. So cut the smoking out. If you can stop it, fantastic. Same with alcohol. Cut it out. If you can stop it, fantastic. Eat healthy. Fresh fruits, wash it. The other thing which we talk about, generally speaking, in pregnancy, because cheese lovers, they say don't go for a lot of mature cheese, because mature cheese, we are talking about listeria and all those kind of infections as well. So we need to think about all those. So there are lots of little things which we talk about. There are lots of myths as well, in India, which we need to take into account, because people ask me, can I travel in a motorbike? Of course, she can travel in the motorbike. That's absolutely fine. As long as you're safe and don't fall down or create an accident or a ruckus for someone in the road, you can certainly travel in a motorbike. Or can I climb a flight of steps? That's absolutely fine as well. Do it slow. Don't lose balance when you're pregnant, because, or even prior, because that can lead to problems. So have a healthy lifestyle, have a bit of walking, cardiac exercises do help just to maintain, so that nothing goes a little bit, because higher weight increases risk of miscarriages as well. So that's something which we need to look at. So increased weight leads to miscarriages, and anything else which, fat and all those things. Because I know a lady's pregnant, as far as I see, if I can put it, she comes to me as a tiny thought to conceive. And then she conceives. Then when she comes, to me to see me later phase of pregnancy before delivery, she's tripled her size. For what? Say eat for 2, eat for 3, if it's triplets.
Yeah.
It's even twins. It's even worse. It's not eating for 2. You're eating only for 1. Baby will take what's required. As simple as it is. So, have a healthy lifestyle, and cardiac exercises helps. Simple walking, it can do miracles. Not chit-chat walking as we see along our societies. Just have a simple walk, brisk walk. That should do.
Okay. So you were talking about how smoking is not exactly very good. But now we all know that, when you're pregnant, you're not supposed to smoke, you're not supposed to drink. But for how long, especially, in the case of women, before even trying for a pregnancy, should women sort of give up on smoking or alcohol? Because I'm sure the effect of these things stays in the body. It's not going to be instantly, right? Like I quit today and tomorrow my body is completely free of the toxins I've been sort of abusing it with over the years.
Yeah. The sooner the better is the answer for that.
Okay.
How it works is, I see patients come into my clinic and say, Doc, we were not trying, but I'm pregnant. Then the question from my side is it a pleasant surprise or is it something horrible? They say, no, it's a pleasant surprise. When that's going to be the answer, then many a times things happen without planning. So, and, we can certainly live without smoking or alcohol. So if at least until you sort it out, get the baby out of the way, then carry on with your life, that is absolutely fine.
Okay. Another thing that I want to talk about is sugar, right? It's sort of the new smoking, as everybody says, and there's a lot of research out there also. It says sugar can lead to cancer later on in life, so on and so forth. Of course, with sugar there's diabetes, that nobody can sort of deny. So would you say that excess consumption of sugar, then be it hidden sugars in processed foods or just sugar in your tea and coffee, could also have a role to play when it comes to fertility or even an unhealthy pregnancy?
Yeah, because when you say sugar is carbs, right? So even rice is sugar, but doesn't taste sugar. It's all
not
carbs,
sweet.
right? Yeah, exactly. So when we talk about sugars, cut it down, limit it. Because always, irrespective of diabetic or non-diabetic, if you're going to consume something which has got a low glycemic index, which the sugar is spread all around, say olden day diet, say wheat is good, okay, and ragi is good, or any of those sort of varieties. I don't know the English names for it, but the olden day diets, just like
Barley, jawar.
oats, all those things, they're all good. So all those things will help, but again, don't overload it, because it's any overload is an overload. The sugar which we consume should be spread out smoothly, so it's okay. More so for people who have got a strong family history of diabetes, then they should be even more cautious, because what happens, we always check out for diabetes in pregnancy earlier, and also in someone who's trying for a baby from the fertility perspective, we check out their sugar levels before we put them on the fertility journey. So just to make sure that the sugar levels are absolutely fine. Like say, check the HbA1c, which tells you the 3-month leveling of sugar and all those things. So make sure that is okay. Then they embark on the journey. Because if at all the sugar goes haywire in pregnancy, then again the risk of miscarriages is very high, as well as the baby can, any defects in organ formation can happen in the baby as well. So we need to be quite cautious on all those fronts. So keep an eye on the sugar levels. This I'm talking specifically for diabetics, but otherwise as well, in order to lead a healthy lifestyle and carry on with a healthy pregnancy, to prevent yourself from becoming a gestational diabetic, reducing the sugar content is always good.
Okay. So let's move on to a very pertinent question, I would say, because there was a time when IVF was fairly unknown, but now we are talking about it on a platform like this. There are multiple other conversations happening because there are also multiple practitioners. So what should a couple keep in mind if, let's say, they're considering IVF? What should they keep in mind before choosing a clinic?
Okay, that is quite a tricky question, should I say, or a difficult question, rather tricky. The reason is because, India is a country which doesn't have a great deal of, platforms for me to say, okay, I'm sitting in Bangalore, I want to go online, check out which is the best fertility clinic. Does the government have any document related stuff? Because, say, for example, if I can quote, where I trained was in the UK, where they got a registered body, which is called the Human Fertility and Embryology Authority, where you can look at success rates of any fertility unit across the UK, all over. So you can say, what's their IUI success? What's the success rate of a 42-year-old? We don't, unfortunately, have that privilege yet. But I'm sure that's bound to come at some point. So since that is lacking, the next thing which we see, at least, people talk about pregnancy rates. If I say, someone comes to say, what's the pregnancy rate in your clinic? Number one. And the next thing is, there's another one called clinical pregnancy rate. Okay. There's another one called live birth rate. And the pregnancy rate could be a biochemical pregnancy rate. So we also need to learn to tease where we are looking at. All right. Because what sells for me is what I will say. Right. So that's pretty, that's how it's got to be. So say if someone comes and tells, I always like to look for the live birth rate. Okay, because the number of transfers, what is the number of transfers we do? What is the success rate of transfers on that one? Which means, say, I do 100 embryo transfers. Of the 100 embryo transfers, say at least 50 are clicking. Of the 50, that is a biochemical pregnancy. I'm not seeing a pregnancy there yet, but the hormones are in the pregnancy range. That's about it. Then maybe 3-4 weeks later, we scan the patient. We look out. Say we can see the baby, we can see the heartbeat. Then we say, okay, yeah, this is a clinical pregnancy. So that becomes a clinical pregnancy rate of the 100. But there will be a gradual dip from what is the biochemical pregnancy rate initially and what becomes the clinical pregnancy rate. There will be a slight reduction in that because some miscarriages do happen. And from the clinical pregnancy, how many becomes the baby in the end? We need to look at that as well. So again, there will be another little dip from the clinical pregnancy till they end up in the baby. So miscarriages do happen on the way, and that is how we need to decipher. So what is the live birth rate in any center? If they can get to know that, then there you go. Because when we talk about fertility on its own, there are three main things which we need to look at. One is your doctor. The next is the lab. The next is, which is also equally important, is the technical skills in the lab, which comes in the form of an embryologist. So all these things coming together is what will give you the, on an average, we talk about the success rate of IVF being about 35 to 40% in a general consensus. Younger the girl and good the reserve, better the sperms, more the chances.
Okay. All right. So now let's assume a couple's, decided, okay, I need to go see a fertility expert. They've chosen a clinic. They've come to the stage of IVF. What can the woman in the couple do to ensure that her chances of implantation with IVF are high?
Okay, that is that's a $6 million or $22 million question. I wish I knew the answer straightforward to that, because how it works is when we talk about success rates, main thing again, the quality of embryo and the quality of endometrium. Because the quality of embryo we can judge, we know in the lab when we see, okay, physical indicators are there, but How is it going to perform? We cannot say, because there's something called a crosstalk. When we put the embryo into the uterus, where the endometrial lining is, which serves as a bed for the embryo to implant. So how it works is the crosstalk happens between the chemical mediators in the blastocyst, which is the embryo, and
Hmm.
the endometrium. If the crosstalk is going to be good, then the implantation happens. If the crosstalk is not going to be good, then there's a problem. The other thing which your physician generally takes care of is the lining, because we talk about further other things, like we do something called an endometrial scratch, where we try this. In some cases improves implantation in the patient, which is done by the physician. They will discuss it. And again, the protocol which is being used to make the lining of, which is the endometrium, thicker. As long as the endometrium is more than 7 mm in thickness, the implantation possibilities are higher in a lady who's got a very good quality of embryo. So there are a few things which the doctor can sort out and the labs can sort out, but unfortunately, when it comes to the patient, she is powerless. Unfortunately, I must say that. So it's up to the doctor and the lab which will help them. Because the lady, all she does is just maintain the healthy lifestyle, listen to what the clinician tells them to do, and follow it. And then I think it'll get her through.
So no home remedies, just a healthy lifestyle
No,
and conversations with your doctor.
that's about it. Positivity. That's very, very important, because
Hmm.
how it works is, I've seen it. Best of embryos in my patients, if I were to say, I've had patients, recurrent miscarriages, multiple, coming, sobbing in clinic. Everything is fine. Is it not? Why is it not happening? All it does is, send her to a counselor, for her to confide in. Because, how many women are so happy to discuss everything with their counterparts called husbands? They
Yeah.
want to get away as well, because, they can't keep sobbing. The guy's irritated, so is the girl as well, because things aren't happening. She bears the brunt in the society. So a counselor comes into play there. So counseling helps, a lot of reassurance, a few sittings. Don't rush. Take it easy. Embryos are there. They're not going to get old like the eggs. So the embryos are sitting there. Reassure the lady. And once we reassure the lady, get the counseling sorted, then bang, it will happen. Because in my scenario, in my clinic, I've seen a lot of patients, they just convert. They are over the moon and they don't know what happened. All they need to do is just put them back into them. The confidence would have been there the first time they went to the doctor, but now where has it gone? So put it back so that, when she's empowered, she can do miracles.
Yeah. Okay. So before we bring this session to a close, would you want to say something to couples considering fertility treatments or even IVF? Like, what would your advice be to them?
Okay, I'd say patience is virtue. Okay, forget about who the neighbor says and what your uncles or aunties say for you. Just stay positive. It will happen. As I say, if it's not happening more than a year, because fertility is all age dependent. Okay,
Hmm.
anyone in mid 30s, seek help straight away. Please, please do not wait at home, because at times the common thing. Okay, my one of my great grand uncle, they conceived after 10 years of trying
Yeah.
and all. Please just put that away, seek help, because we are not living in that age now. The science has developed a lot better. Check it out, stay positive, and that is very, very important. Do not lose hope. That's the key.
Okay. All right. Thank you so much for your time today.
All
This
right.
has been really insightful and it was a pleasure speaking with you.
Same here, same here. Thank you very much, and thanks to all the audience who've been listening in over there. And if at all you need any further questions you might have or anything, you can connect through Hindustan Times to me. Thank you very much.
Thank you. Have a nice evening.
You too. Bye bye.